Hello everyone, it's Thursday and you're watching Within the Frame. I'm Kim Bo-kyung. Starting this Thursday, South Korea has declared COVID-19 an endemic disease. As the crisis level went down from the top level to alert, accordingly, nearly all COVID-19 restrictions have been lifted. Major changes include the mandates for self-isolation and indoor mask wearing. Yet, as South Korea is seeing the number of new COVID-19 cases still hovering between 10,000 to 20,000 a day, some cast worries over whether it is really safe to have all those restrictions eased. Is it really safe? And what preventive measures do we need to tackle another possible health crisis? For an in-depth analysis, we invite Dr. Seung-taek, virologist at Institut Pasteur Korea. Dr. Kim, welcome.
Good evening.
And we also have Dr. Peter Chin-hong, professor at the University of California, San Francisco. Good to see you, Dr. Chin-hong.
Same here, Bo-kyung. Thanks for having me on.
Thank you for being with us. Now, Dr. Kim, first question to you. South Korea's number of new COVID-19 cases has been staying above 20,000 for the second straight day. Are recent figures within the manageable range? And what criteria did Seoul government consider when it was deciding to downgrade the COVID-19 crisis level?
Well, the number of confirmed cases are actually just a little bit just up and down, but I see the numbers are pretty just stable as of now, right now. And then now one of the major reasons that the government actually just say now we can go to the sort of just endemic phase is the major reason is that our just population immunity, our population immunity, whether it was conferred by the vaccination or just the infection, our just anti-population has a pretty just good just immunity against the SARS-CoV-2, the causative agent of COVID-19. And then what it means is that well, the viruses are still just hovering just around our country and on the globe, but then we can also still can be very vulnerable to the infection or just a multiple infection. But the thing is that our immunity actually confers us some proper protection. So we can be infected, but the good thing is we cannot be easily progress to the severe diseases. So that's the whole idea of that we can actually now just switch it to the sort of just endemic phases.
Right, I see. So the number itself is stable right now, and what matters was the population immunity. Right. Now, one more question. As the COVID-19 crisis level has been downgraded from the top level to the alert, it brought an end to most of the remaining COVID-19 restrictions. And thus, those who test positive will be recommended to rest for 5 days instead of a 7-day mandatory quarantine. Is it safe not to have such a isolation period, and what measures should be in place to guarantee people to have this right to rest?
Well, first of all, in terms of just a safety point, that it is not really, absolutely the safe, because the isolation is obviously just the most, just the best way to just prevent further the transmission. But when we actually think about just the flu, and now just the level of just the risk level of the COVID-19 is now very similar to the level of just those of the flu. And in the case of flu cases, we do not actually just mandate the isolation. So now just all those the things are now just moving back to the normal phases, and they're very similar to the case of the flu. So and then one of the things that we have to consider is that when we actually just recommend the self-isolation instead of just mandate isolation is in the school system it's going to be all right, but in the case of some employee cases, I think somehow just not all the employers are in the same situation. So they are thinking about some of their profit and then earning things. So in that case, we have to somehow just establish, just a social culture that guarantee that now, the employees can just, take a rest without any just hesitation.
I see. Now, Dr. Chin-hong, we cannot say the COVID-19 risk has completely gone, and doctors especially have highlighted the importance of effectively protecting high-risk groups such as the elderly and immunocompromised. Now, what preventive measures should be in place for people in this category?
I think as you move to an endemic phase, the risk mitigation moves from a population level where everyone moves like blades of grass all together to individual protection. So that means it's really crucial for those at high risk, like the elderly, like the immune compromised, to really protect themselves. So I think about 4 things. the first and most important thing is to get an updated vaccine. We know that immunity wanes the fastest in the older you are. The second is, of course, test if you have symptoms. It seems like a no-brainer, but you need to know what you have so that you can have access to the third intervention, which is Paxlovid or early therapies. That can prevent hospitalization by as much as, and death by as much as 90%, even in those who are unvaccinated. You have to be worried about drug interactions, but please consult with your healthcare professional before that. And of course, the fourth thing, which is the cheapest and easiest thing to do, is to wear a high quality, well-fitting mask.
Well, I see. So those are 4 rules that high-risk groups need to follow. Right, now, Dr. Kim, let's take a look at how COVID-19 is affecting other countries here. Bloomberg says, though the global COVID-19 emergency is officially over, it is still killing 1 person every 4 minutes, and it is still a leading killer, the 3rd biggest in the U.S. How are other countries currently being affected right now?
Well, I just checked just sort of the up-to-date the status. And then when I just look at the number of just total cases in the last 7 days, the number of just the total cases on the global scale is now just 278,000 about. But then in South Korea, the numbers are 111,000, which is, what it means is that our just the total number of just the confirmed cases actually accounts for 40% of the total just global confirmed cases.
Really?
Yeah. So what it suggested is that in Korea now just more people are just actually just getting just tested the COVID-19. I think now not just in Korea but just globally, the people are somehow just hesitate to get just tested. And now the COVID-19 is not really just a serious issue. I mean, for the just a normal just adults. So that somehow also there are some business issues. Somehow even if they have some symptoms, if it is not really just more severe, they do not actually get tested. So that's why now the number of just the confirmed cases in Korea accounts for 40%, which is actually surprising for me too.
Yeah, it really is. Now, Dr. Chin Hong, China particularly is bracing for a new wave of COVID-19 here that could see as many as 65 million cases per week at its peak at the end of June. How worrying is this? Do we need to be worried about this?
Well, I think the current peak that's emerging or the surge that's going on in China is really fueled by the XBB subvariant. We've seen XBB in other parts of the world, but it's probably not going to have the same impact in other parts of the world than it is going to have in China. And that's because that experience may not be generalizable to other countries. First of all, as little as 6 months ago, China was in a zero COVID policy. What that means is that they haven't had as many waves. So like what Dr. Kim was saying, if you think about population immunity in South Korea, you don't necessarily have that in China. So they're kind of like backward in time, almost like a year or two earlier. The second is that the vaccines in China that have been used have not been the same mRNA vaccines that have been used widely in South Korea and other places. So it may not give the same protection up front. But I think above all, we're worried because we don't know if we're going to get timely data from China as this surge goes on. And I think transparency is everything as we live in a global world, a global economy.
Right, I see. So though there are some worrying aspects, could we say that the subvariant XBB is not that much of a risk right now?
Well, the variant can look as scary as XBB, but one thing is the virus and the variant, but the other aspect is the soil in which the variant lands. If XBB were around in March of 2020, it would be a much different story than XBB in 2023 in South Korea because of that population immunity, because of vaccinations with good vaccines, because of access to Paxlovid, which isn't quite as available in China. So I think all of these measures and interventions mitigate the impact of even a scary looking variant because that soil is very inhospitable.
Right, I see. Now, Dr. Kim, though we could say that the impact could be quite mitigated, but I believe that there could be still the chances that a new variant could emerge, right? And with the virus no longer considered as a global health emergency, I wonder if the world will be able to tackle it if the strong new variant comes. How do you see this?
Well, I think the viruses somehow also try to find a way to just mutate. I mean, the viruses actually mutate. That is not actually just a surprising news among the virologists. And then maybe a major driving force at this moment is that the selective our immunity. That's the main just selective pressure. And then virus are somehow it is not their intention, but somehow random among the random mutagenesis event, they try to somehow just evade the neutralization by just our antibodies that actually just elicited by just prior infection or just vaccination. But I think based on our just 3 years of experience so far, but the thing that I can tell for sure is that well, even after like some sort of just a strong, I mean, just the variant, our just a T cell response. That's another just aspect of another just armament of our just immunity conferred by the infection or just vaccination. Our T cell response is still just that's good enough. So the major function of the T cell is that just kill the infected cells. So which means that the infected person cannot easily just progress to the severe disease. And then another thing is that we have a couple options of just some therapeutics, including the Paxlovid and the remdesivir and the molnupiravir. And the common thing is that those are actually targeting different just domains of the viral protein, which is not the sort of just famous spike protein. And then so far there is some report of some resistant mutation actually just emerged from this SARS-CoV-2, but still in some real settings, those drugs are still very effective against the potential just variants of the SARS-CoV-2.
I see. I mean, it's good to hear that our T cell response is good enough and that there are many treatments that we can get.
Sure.
Right. Now, Dr. Chin Hong, another worrying aspect, though, the CDC's principal deputy director said in early May that the CDC will have less authority to collect public health data, meaning it will be hard to track the spread of COVID-19 and new variants in the U.S. as the public health emergency ends. How concerning is this, and what are problems with the country's own health authorities have to face with the end of this PHEIC?
Yeah, so in the United States, one of the benefits of having a federal public health emergency on a countrywide level was that we were able to share data, or data was mandated in terms of sharing with the CDC. We don't have a national health information system. We don't have a national healthcare system. So this was really crucial in the beginning. I think right now, there is some data that's still going to be shared, like hospitalizations and deaths, but not cases. And a lot of people are testing at home anyway and not reporting those. I think in the meantime, what the CDC has prioritized is a limited look at wastewater epidemiology in various jurisdictions around the country to capture what's going on with a potential new surge, for example. The second thing that they're going to do is actually already started in San Francisco in the international airport, is to look at the wastewater of international planes coming in, so you can have surveillance from what might be happening in other countries as a bellwether of what might happen in the United States. So I think data is more imprecise now. It's not coming in real time. The hospitalization and death data, instead of being updated daily, it's updated weekly. And of course, variant analysis takes at least 2 weeks to get. And again, you're not getting it from everywhere anymore. In terms of a global end to the public health emergency, I think we're worried that you're not going to have as much data sharing as we used to do. And more specifically, you're not going to have as much sequencing in various countries that can, again, help predict what might be going on in one part of the world, and that might come to another. In other words, that's how we knew about Alpha and Delta and even Omicron, based on what was happening in other parts of the world.
Right, I see. Those are indeed worrying. And we will talk about how we should tackle this kind of problems later in our program. But in the meantime, I'd like to ask our Dr. Kim, we need to deal with the aftermath of COVID-19 as well here. And recent data suggested that 15% of U.S. adults experience new or, lasting symptoms months after their initial infections. And we call them long COVID, right? What are its symptoms and what kind of further research do we need?
Well, this long COVID, this is not just a new phenomenon. I mean, even just earlier, just the COVID-19 pandemic, many people actually suffered from sort of just a long COVID. And then there was many questions on this long COVID, because one of the things, even just the definition of long COVID was not really just very confusing among the clinicians and then some CDC and the WHO, because there were actually dozens of symptoms were reported.
Right.
And then now just a recent study actually identified the 12 major symptoms, which includes like fatigue and the brain fog, dizziness, and then thirst, the loss and change of smell and taste, things like that. And then scientists actually investigated a lot about this long COVID, and then now the people are suspicious about the maybe very trace amount of virus may just cause this long COVID, or like some immune response or like some inflammatory response actually causes these symptoms of just a long COVID. And then the good thing that we actually now, for sure, after some large-scale studies, that the vaccination is actually to reduce the chance of long COVID, and also just a Paxlovid treatment also reduces the chance of long COVID. But other than that, there are still just many things that we have to learn about from this long COVID.
Right, I see. Now, Dr. Chin Hong, coming back to you, I saw that you said that though COVID-19 was likely a once-in-a-century sort of threat, it does not rule out the risk of other pandemics in the future. And I also saw an article that said the period between the arrival of other health threats is getting shorter and shorter. Now, before we get to the preventive measures and mechanisms that we need to come up with to tackle effectively these possible health crises, why is the period of time getting shorter and shorter?
Well, I think there are three factors that's probably responsible to all of these outbreaks and epidemics coming one after the other. In fact, the WHO has now designated at least 7 public health emergencies of international concerns since 2007, which is shocking. Includes Zika and chikungunya, Ebola, etc. There are 3 reasons. The first is that the world's population is increasing in size, and as it increases in size, people are living in places where they weren't living in before. So you have spillover of pathogens from animals into the human population. And if humans can then transmit it to each other, that can be concerning. The second reason, of course, is we live in a very global society. So in the old days, it took like many days for a ship to go from one country to the next to bring an infection. Now it just takes a matter of hours. And you can see that dramatized in many movies as well as in real life as what we witnessed in the COVID pandemic. And then the third reason, of course, which is emergent, is climate change. Climate change is very insidious because it not only increases the diseases that we know about, like diarrhea and other diseases like malaria, because insects are living in places that carry the disease where they don't normally live. But it also potentially increases the occurrence of new infections, like melting the permafrost, unearthing ancient viruses, or making animals who normally live in one place move to other places to live because they're looking for water and food that they couldn't get. So I think these 3 factors are real reasons why we're seeing more and more of these epidemics and pandemics.
Right, I see. Now I see the point. Dr. Kim, with that being said, what should health authorities keep in mind to be well prepared for another possible health threat?
Well, just Dr. Chin Hong said the sort of just the term of just One Health. In One Health, we are actually considering just the animal health and the ecosystem in addition to the human health. So regarding those things, now just experts are actually suggesting some measures. For example, now just we have to think about just smart surveillance to identify some high-risk pathogens. For example, like identify hotspot area. And the second one is just preparing just a future pandemic or just epidemic. For example, like we're prepared as like a broad spectrum antivirals or some new platform technology for vaccine development. And then for probably just one of the last things is maybe reducing the drivers of spillovers and then the spread. For example, we can maybe just reducing the maybe wildlife trade and then consumption of wildlife. Those things are some of the things that we can actually just think about.
All right, I see. I'd like to ask more questions to our experts, but unfortunately, this is all the time we have for today's edition. Thank you, Dr. Kim and Dr. Chin Hong, for your insights. We really appreciate it.
Thanks so much.
All right, that's all for Within the Frame tonight. We'll be back tomorrow with more in-depth stories. Thank you for watching and goodbye.